I know a lot of doctors. I work with a lot of doctors, and I didn't find a lot of support for it. I found a lot of people who were really quite disappointed with it.
And what bothered them, doctor? What was it that caused them the greatest concern?
Well, first of all, it's an expansion of the bureaucracy. You know, what do you need for good health care? You need a patient and you need a doctor. Along comes the middleman to facilitate the relationship, and it has become this mammoth creature that completely controls everything.
Well, that was Dr. Benjamin Carson of Johns Hopkins University appearing yesterday on Fox News Channel's Your World with Neil Cavuto. He's made headlines for knocking the president's health care law during the National Prayer Breakfast. His comments come as a report shines a light on a problem in the first state that tried to implement the law. California has realized that it does not have nearly enough doctors to handle the influx of new patients. According to the LA Times, only 16 of the state's 58 counties even meet the federal government's recommended standard for number of doctors. What's more, almost 30% of California's doctors are close to retirement age, and that has some suggesting that the state expand the definition of doctor to allow nurse practitioners, pharmacists, and optometrists to act as primary care physicians. Let's debate this. Leslie Marshall is a syndicated radio talk show host and Fox News contributor. Chris Plante is host of The Chris Plante Show. Welcome to both of you.
Hi. Good morning.
Chris, are you comfortable with your pharmacist giving you your full exam next time you go into CVS?
This is just classic big government tripping all over itself to try to correct their last error, isn't it? So now we've got, what, the Cuban model, the Venezuelan model for medicine in America. No, I'm not. No, I like going to a doctor. That's the way that I grew up. Call me a spoiled American. But California, once again, the condor in the coal mine here, is leading the way. And they're showing us that this debacle of a health care bill is going to create more problems than it solves. And they're coming up with solutions that are not solutions at all, that are just going to make matters worse and kind of third world our healthcare system, as it were.
And Leslie, it's not like we didn't know that this was a possibility. I remember doctors on Fox News, our medical A team, warning that with the influx of new patients that we'd see with the Affordable Care Act, aka Obamacare, that we would have a doctor's shortage, and sure enough, now it's happening.
Actually, statistically, you're right, but long before, actually, President Obama was a president. My husband's an orthopedic surgeon. I co-own a medical center. Know a lot about this one, guys. And I live in California, Chris. You don't have to come out here. I would agree with Chris. I don't want my pharmacist giving me medical information. But almost every woman out there can nod your head. How many times has a nurse practitioner or a PA drawn blood or done a pap smear? There are already people in doctors' offices, because of the volume of patients, who are assisting physicians in the manner that they should. That being said, we did not look at the number of retirees. January 1st of this year, excuse me, last year, with 10,000 people a day for the next 19 years entering Medicare, people crowding the emergency rooms, hospitals having to merge, they don't have enough staff, emergency rooms and hospitals closing down. This is why, quite frankly, the Affordable Care Act didn't go far enough. And when you look at doctors' reimbursements being cut, not only by the federal government, by the private sector, absolutely no caps on medical malpractice. Now you're going to get to sue your nurse practitioners, your PAs, and your pharmacists. So, Chris, I would agree with you. This isn't the answer, but you can't blame it on the Affordable Care Act. This was a monster.
Okay.
This was a storm, a perfect storm about to happen.
Okay, Chris, do you agree that this has nothing to do with the Affordable Care Act, that this is in fact what the Obamacare was designed to try to stave off all of the sort of ominous picture that Leslie was pointing out?
No, you'll be surprised to learn that I don't agree. I love California. I lived in California for 7 years in Santa Barbara. It's a great state. It's too bad that it's falling into the ocean because of insane leadership. No, look, you just articulated the problem in a new way, and that is that it wasn't anticipated that we're going to have all these doctors retiring, 30% or something of doctors in California retiring. So the problem is going to get worse and worse. But we knew that the population was aging. One of the reasons we wanted to take this on. Kind of a major oversight in the scheme of things, I've got to say. And if we've already got healthcare practitioners in various medical offices performing all of these tasks, then that means that they're already at critical mass. I mean, the solution is not to throw more patients at the number of the small number, the inadequate number of healthcare providers that we have.
Yeah.
And in fact, that there is no solution. Obamacare is responsible for this. Obamacare was supposed to be the cure for this, the remedy for this, the fix for this. And it's not only not the fix for it, it exacerbates and compounds not just the central problem, but all of the micro problems along the way. It's a catastrophe.
I want to get Leslie in for one last answer, Leslie. Even if Obamacare didn't cause the shortage of doctors, and that could have been a gathering storm, as you point out, what about what Dr. Carson said, which is that it does expand the bureaucracy, and that's not what doctors ever wanted?
Doctors never wanted that, but before the president was president, for crying out loud, 10, 20 years ago, this started happening even before that. We have less people entering the medical school profession. They can't afford to pay back when they come out as a general practitioner, family medicine, or an internist working for an HMO for 75, 80 grand a year to pay back $500,000 in the medical school cost. So this is both ends, retiring and those entering the profession. And then you just have to look at the restraints. The reason my husband has to run so many tests, Chris, is not because he has so many patients, which he does. It's because he has to cover his butt so he doesn't get sued. That's how it is. That's what we've done in America. So we have not been personally responsible as patients. We flooded emergency rooms, and the government then said, whoa, in America, we have a problem. We didn't look into prevention. And that's what the Affordable Care Act is trying to turn the clock back to do, so that we can go to our doctor like the good old days.
Of course, I mean, as we know, the Affordable Care Act and Congress did not go anywhere near tort reform, certainly not what doctors
didn't go far enough.
Were calling for. Leslie Marshall, thanks for your expertise. You were exactly the right person to book on this. And Chris Plant, thanks so much for the debate.
Thanks.
Thank you.
All right, as we get new